Dr. St. John wrapping up here on the endocrine system. So we covered a lot of different components of the endocrine system, some of the functions here, and I just want to discuss and go over some symptoms that you will often experience if you have an endocrine issue in the body. The number one thing we find in our clinic, and it's besides back, neck, and joint pain, fatigue is really a huge condition that we're treating in our practice. And if your adrenal glands are under functioning, if the thyroid's under functioning, you're going to have fatigue. So that's a big one. Low libido, that's another one. Headaches, especially migraine headaches in females, it's often a pituitary issue. Circulation, if you have cold hands, cold feet, you have a circulation issue, oftentimes the thyroid is under functioning. And let me just say this, you might go to your medical doctor and get a thyroid blood test, but the thyroid panel is normal. Well, I would say it's normal in about 50% of thyroid cases. So it's not a great test to uncover thyroid issues. Yes, if you have a thyroid issue, it's going to show up on blood tests, but you can often have one that's more of a functional issue that wouldn't show up in blood, but is necessary to treat. PMS, premenstrual syndrome, cramps, bloating, menopausal issues like hot flashes. These are often thyroid or pituitary or adrenal gland issues. And last but not least, diabetes. Diabetes is a pancreas issue, and it's just from consuming too much sugar and starch over many years, and you're just wearing out that pancreas. So when you're going to a medical doctor, I just want to dive into this for a moment. When you're going to a medical doctor and they do a panel and they find your hormones are low in a certain way, what do they typically use for treatment? Well, hormone replacement therapy, right? Well, at our clinic, what we choose to do is we try and find, well, what is causing this gland or organ to not function like it should? Usually it's some type of nutritional deficiency. Sometimes it's a toxin like a heavy metal or chemical. Sometimes it's a food sensitivity. Sometimes there's some type of an immune issue going on with that gland. And these are all things that we can handle and address and have for about 20 years now. What happens when you take a hormone for the thyroid, for example, the thyroid will stop functioning because when you're placing that hormone into the system, it's called thyroxine, the thyroid's going to say, well, we have normal levels of that hormone in our system, so we don't have to work anymore to produce that. What we prefer as an approach is to use hormone replacement therapy as a very last resort, okay? The majority of the time, we can feed that organ or gland with whole food supplements, glandular extracts, herbs that are all safe, natural, and effective, and handle it from that approach. For example, if someone has adrenal issues, the adrenals, they run on electrolytes and vitamin C and copper and other nutrients. The pancreas, you might be missing B vitamins or zinc or chromium. The thyroid we talked about. The pituitary, sometimes manganese is deficient, and that's necessary for pituitary function. So we are well adept at identifying nutritional deficiencies for these glands and seeing how they all interact together and making sure everything balances out and synergistically functions and communicates together, because that's what's critical for the endocrine system. All these components work together and they all need to be balanced and harmonious. So hopefully this was helpful. At Chagrin Natural Health Clinic, we treat most health issues naturally. We're passionate about what we do. We're here to help. Please share this, like this information, send it out to someone that may want some more information about how their endocrine system and body functions. Take care.